Good day, everyone. Nakosa welcomes you to our Youth at Risk webinar, and we have some amazing speakers. So before we start, let us just be aware that thanks to Happy Clouds, we have sign language interpretation on the screen for those that require it. Also, please note that in the chat, you have the opportunity to ask any questions to the speakers that we will take note of and put it forward at a later stage after their presentations. So once again, just a warm welcome from Nakosa. Through the Global Fund grant for the Adolescent and Young People program, we are privileged to host this webinar on youth at risk. Many young people avoid seeking healthcare or services because they face judgment, rejection, mistreatment, and are not understood. Others face practical barriers like clinics that are not accessible and lack of information. Members of the LGBTQI community, young people who use drugs, young people who are involved in sex work, young people with disabilities, they can face increased risks. This webinar will explore the unique challenges faced by young people who are not available or able to access services due to heightened risks of poor health, social exclusion, violence, stigma and discrimination, and human rights violations. Nakosa, also through this platform, will be sharing our policy brief on harm reduction services for minors that was commissioned by Nakosa and developed by one of our speakers on this webinar from Students for Sensible Drug Policy International. So without further ado, let us get straight into it. Young people or young LGBTQI plus people are at increased risk of human rights violations, and this really is driven by hate-motivated violence, harassment, breaches of violence or privacy, and barriers to accessing respectable, non-discriminatory health and social services. We have a video that was supported or collaborated by several key stakeholders and drivers of the rights of LGBTQI plus community members. Please take a minute to reflect on some of the key violations that are represented in this video.
We find out that human rights violations happens every single day. Gambrella is an organization that advocates for the rights of LGBTQI people in the Northwest. We are trying to make sure that services for the LGBTQI community in South Africa is available. How do we build an inclusive space where we support each other?
There's a difference of calling a person out and calling a person in. PIFSEC right now has more than 10,000 members of parents who are saying, we want to learn, we want to advocate. We are encouraging parents to allow themselves to be first-timers, begin to learn new things that they've never learned.
We won't see the change now. We will see the change that we are currently advocating for. We will see it in years to come within our children or our children's children.
Once again, just a warm appreciation for the organizations that are constantly on the ground, working with these communities and particularly young people, and are still struggling to ensure representation and access to services. And one particular icon that is available today to speak on this is Faith Edmonds from Color Me Foundation. Faith is a community leader, a LGBTQI a plus activist and the executive director of Color Me Foundation, an organization dedicated to advancing inclusion, visibility, and economic empowerment for queer people in rural areas and small towns. Their advocacy focuses on identifying and addressing policy gaps that continue to place queer youth at heightened risk and vulnerability. She offers practical insights on building inclusive systems, strengthening and community support, and ensuring that no young person is left behind because of their sexual orientation, gender identity, or expression. So, Faith, welcome from Color Me Foundation, and may I openly wish you a happy birthday and appreciation for you sharing your time today on your birthday. Over to you, Faith.
Thank you so much, Yolan, for that beautiful introduction. Let me firstly commend Nakosa for the work that they are continuing to do, and thank you so much for the well wishes. As you have introduced me, my name is Faith Edmonds. I'm currently the Executive Director at Color Me Foundation, which is a feminist-led LGBTQIA plus organization that deals with young people in rural areas and small towns. I'm not seeing my slides. Somebody can assist me.
Faith, we see slide 1. When a young person hides who they are to survive, we have already failed them. Can you see your slides now?
No, I don't see my slides on the screen, but I will just continue. Thank you so much for that wonderful quote. When a young person hides who they are to survive, we have already failed them. So as I've previously introduced Color Me, which is a rural feminist-led LGBTI plus organization, working to ensure that every young person, regardless of their sexual orientation, gender identity, gender expression, or sex characteristics, can live, learn, and access services safely. Color Me Foundation was founded in 2018. We formalized it as a nonprofit organization in the year 2021. And in 2024, we launched the Be Free to Be You campaign that began in TVET colleges, which are based in rural areas and small towns within the Northwest Province. And since then, we have expanded into high schools because for us, one truth became impossible to ignore. Young LGBTQIA plus people are surviving schools instead of thriving in them. Over the past 2 years, we have facilitated dialogues with learners, educators, and student leaders, creating spaces where young people could finally speak honestly about what they experience on a daily basis. We have engaged to date with 8 TVET colleges in the Northwest Province, particularly in the Bojanala district and Ngakamudiri Mulema. And we have had the opportunity to engage with over 1,500 students and 30 educators, and are looking forward to increase those numbers from the 8th to the 10th of July, 2026. When we did this engagement, one thing became clearer for us. The greatest risk facing LGBTQIA plus young people is not their identity. It is the environment around them. No child should have to choose between being accepted and being themselves. When we speak about some of the risks that young people face or young people that belong under the community of the LGBTQIA, we have had the privilege to speak to young people from the ages of 15 to 24, and many face the same challenges as their peers. The difference is that discrimination turns ordinary challenges into life-threatening ones, because as people, we would have the same interest. Then what separates us is how those challenges come because of your sexual orientation, your gender identity, or your gender expressions. From the high schools and TVET colleges that we have engaged, we continue to hear about family rejection after coming out, parents refusing to accept their children simply because of their difference in gender identity, sexual orientation, or gender expression. We have heard stories about bullying that becomes normalized in classrooms, teachers who misgender learners in front of others, hate speech disguised as jokes, learners being publicly humiliated because they are different. We collected this data from Patima High School within the Northwest Province and Orbit TVET College that belongs in the Bretts campus. Lesbian learners being sexually harassed under the belief that someone can change them, and we are all aware that there is something labeled as corrective rape that is still being normalized in society even today. We have had 12 cases reported to us through our WhatsApp line. We have had transgender learners being denied access to toilets or forced to use spaces that do not match their identity. All of the schools and TVET colleges that we have engaged are still facing this very same challenge today, where a transgender identifying person can not be able to access the preferred bathroom that they want to use. We have had cases where intersex learners are being forced to expose their bodies so that adults or peers can prove whether they are male or female. We have had 3 cases reported on our WhatsApp line and witnessed a student in high school who is continuously violated and embarrassed because they have a different sexual characteristics from other learners. For us, this is not curiosity, this is violence. Many young people stop participating in school activities. Some stop attending classes. These are not isolated experiences, as most of us who are activists are already familiar with the national and international evidence that shows that LGBTQIA plus learners are significantly more likely to experience bullying, exclusion, and poor mental health because of stigma and discrimination. Kalami Foundation was called for an intervention at one of the TVET colleges, Vuselela TVET colleges, and in other 2 high schools in the Dr. Ruth Sokomotse Mompati district, Bopahanang and Pudumong High, where LGBTQIA plus identifying learners drop out of school from as early as 14 years. The youngest was recorded to be 13 years. This results also into self-harm, drug use, and homelessness. The deepest wounds are often invisible. They are carried by young people who smile in class but cry when they get home. These young people are trying to put a brave face, a strong front when they are in school. They do not feel safe to speak about their sexualities or their gender identities with teachers. They do not feel safe to speak about their sexual orientations with their peers. So they put on a smile when they are within the school premises, but when they get home, it's a different story. What support actually changes lives? For us, we believe that young people do not need to be fixed. The systems around them have to be fixed. Parents can choose love before judgment. Educators can interrupt bullying instead of ignoring it, because if you are a teacher and you see that there is a child that does not feel loved within the school premises, they feel discriminated, we believe that it is your job as an educator to make sure that you intervene. Healthcare workers can provide affirming, respectful care. Communities can stop treating LGBTQIA plus young people as debates instead of human beings. What we can also do to just amplify safety is to make sure that when we speak to young LGBTQIA plus people, we use the correct name, we use the correct pronouns, we stop making jokes about their sexual orientation or their gender identities. Believing a learner when they say they feel unsafe is one of the things that is going to assist us to create more safer spaces in rural areas and small towns. And young people need opportunities that reduce vulnerability and independence. This includes things such as skills development, entrepreneurship and employability programs, bursaries and educational support, digital and financial literacy, and linkages to employment and income generating opportunities. Policies exist, but implementation doesn't always follow. Most of us are familiar as activists that South Africa has one of the most progressive constitutions in the world. Yet many LGBTQIA plus young people never experience those protections. The gaps remain. Policies are not consistently implemented. There is no accountability. Educators need ongoing training. Referral pathways between schools and healthcare services remain weak. One of the policies that stand out to me as I'm presenting now is the Constitution of South Africa, Section 9, Equality Clause. What it promises is Every young person has the right to equality and protection from unfair discrimination, including on the ground of sexual orientation. But what we see is LGBTQIA plus learners continue to experience bullying, humiliation, misgendering, and exclusion in schools, while many incidents go unreported or unresolved. Implementation falls short because equality is protected in law, but many schools lack accountability mechanisms, educator training, and leadership that actively responds to discrimination. Another example that I'm going to make is the National Strategic Plan on Gender-Based Violence and Femicide, mostly known as the NSP-GBVF. What it promises is to prevent and respond to all forms of gender-based violence through survivor-centered services prevention and accountability. But what we see in these rural areas and small towns is we see young lesbian women who report sexual harassment and so-called corrective violence, while transgender and gender diverse young people experience gender-based abuse that is often overlooked. Services are not always inclusive of LGBTQIA plus survivors and victims. Grassroots organizations such as ours doing this work are expected to solve national problems with project-based funding or no funding at all. Movements like ours continue to show up because our communities need us, but passion cannot replace sustainable investments. Our call to action: if we want different outcomes for LGBTQIA plus people, we need different investments. We need to invest in our educators. It needs to be mandatory in schools for educators to receive an inclusion and diversity training before they start rolling out their syllabuses at the classrooms, to understand that as people, we share many differences, and to understand that the Constitution does not protect a certain group of people, to understand that we are human first before our sexual orientations. We need to also invest in parents through dialogues. We need to make sure that we collaborate with schools, we collaborate with civil movements, so that they can be able to call parents at school and be able to discuss gender and diversity openly. Because what we have realized is that we would meet close to 800 students at school to discuss diversity and inclusion, but many of them come back to us to say the information that you gave us from school is not accepted at home. So one of the things that is going to help us bridge this gap of inclusion and diversity is if we also invest on the parents. We need to also invest in inclusive healthcare, in inclusive mental health, invest in rural communities, and invest in young people. We need to make sure that young people are being given the opportunities to speak their truth in a language that they understand. We need to make sure that we encourage young people who are holding leadership positions in TVET colleges and high schools to include other learners who are able to speak on sexual orientation and gender diversity. One of the things that has prevented us to be able to roll out this Be Free to Be You campaign sustainably in other provinces, it is the lack of support that we are not getting from government, from private sector, and from other civil institutions. Grassroots organizations such as ours are not being funded. We are left to fend for ourselves, and we will not let our community go without the right knowledge and the right resources, only on the basis that we do not have the financial resources. When we were doing our Be Free to Be You campaign this year in Talezo College in the Ngagamudiri, Molema district, we also realized that young people have to be reminded of their human rights. Many of them do not know the human rights that exist for them. They do not know who is responsible and who can we hold accountable if there is an infringement on those human rights. What we are going to be doing differently as Kalami Foundation this year is to make sure that we listen more to young people. We have planned a debate, a structured debate, where young people are going to lead the conversation, where young people are going to tell us that the rights that we see in the Constitution, is it a true reflection of what they are experiencing in their real lives, and what possible solutions can we come up with so that we help them navigate their gender identity and their sexual orientation in those particular schools. We are also going to be hosting the first of its kind visibility walk for Orbit College. They have never had a day dedicated to LGBTQIA plus solidarity. So we want to be able to raise the LGBTQIA plus flag in those colleges and to make sure that visibility, it is not only a policy on paper. Inclusion, it is not only a policy on paper. It is a policy that is translating into real life, that is tangible, that young people can use as a safe space to say, I am being discriminated, and because I belong to this organization or to this institution, this is not supposed to be happening. Thank you very much, Yolan. Thank you so much for everybody that is a part of the listening in the chat.
Thank you so much. Faith, and just look at your last one. I belong, I am safe, my future matters. I think that is what we strive for every young person, for every adult, for every woman, regardless. And it is so disappointing to see that as a country as developed as we are, there are millions of queer youth that do not feel this at all. So thank you so much for bringing this to light. I am opening the floor for questions, but I did notice some key points. Education, education, education. People knowing their rights, others knowing of queer rights, and ensuring that it's enforced. I heard you talk about parents need to be strongly brought into the fold to understand and to elicit change within their families, but that will ripple over to communities. I heard you talking about the risk of organizations like yourself closing down potentially because of lack of funding, not lack of will, not lack of commitment, but the lack of funding and prioritization of queer people and queer youth. And I've also heard you talk about the fact that the queer youth need a voice in program design and program implementation and program monitoring. So thank you for those key points. And I'm just looking to see if there's anyone that would like to raise their hand. You're welcome to raise your hand for any question that you may have. I've noticed some great comments in the chat. I think there's Nate who said, there's a difference between calling someone in and calling someone out. This is incredibly deep. I'm interested in how young people are entering health systems or programs. I don't think risk screening tools are useful, youth-friendly entry points into programs. Nate, you are welcome to speak to this point and have Faith respond in relation to her experience working in schools and colleges with young people, but also particularly with young queer people. Nate, would you like to unmute? Apologies, I don't see Nate unmuting. So any other hands you're welcome to raise for questions? And just to note that the presentations will be provided after this webinar. We'll make sure that the recording and the presentations are shared with all those that are in attendance. And I'm just checking if there's anybody's hand up. Nobody's hand up. So this is my favorite part, Faith, because then I can ask all the questions. So Faith, just a quick thing. how are we bringing parents into the fold? Because we're really struggling with parents. And we're not just talking about, queer youth, even though that's an incredibly important point. And I know, as someone that ran a health service for transgender people, how many of them were facing homelessness because of being ostracized and kicked out by their families because their gender identity, their sexuality. So, what are we doing wrong with parents? And how can we bring them into the fold?
Thank you so much for that beautiful question, Yolan. I think what we've done as Kalami Foundation is that we have started a support group for queer moms. I'm even wearing the t-shirt. I'm not sure if you will be able to see. Yes, this was started in 2020 during COVID because we are also parents, me and my partner. So what we realized is that there were a lot of mothers in rural areas and small towns that did not really know how to navigate just that relationship between them and their kids, since, well, COVID hit and we had to spend so much time with our kids. So we had realized that the challenges are very different and we shouldn't just put a blanket approach on everything. We found that queer parents need the affirmation and reassurance, because remember, if your child is going to come out as queer, it affects your entire family. It affects the parents in terms of the outlook that society has on those particular parents. So sometimes the retaliation from our parents is not necessarily because of they do not love us. It's because of they care deeply for us and they still want to protect us, because they can see what happens to the LGBTIQ plus young people, or just LGBTQIA plus community in society, the many hate crimes, the many corrective rape, the hate speech, and just you being made like you do not belong. So we realize that if there is no organization that affirms those parents, that says to those parents, we will hold your hand, we will give you the right policies, the right information, so that when your child comes out as something different from other kids, you yourself have that support structure. Many of them said to us, we are scared to accept our kids because in church, then my position is being taken away. In communities, I'm starting to be looked at differently. It goes to the extent of even society saying, Faith, because of you identify as a lesbian woman and you have a daughter, you are going to pass your lesbianism to your daughter because that is the environment in which they are in. So we have realized that parents do want to support us, but our approach to them also intimidates them because we automatically say to them, you are not doing enough. You are not being vocal enough for your child. But there's so many cultural, traditional, and religious barriers that we face that prevent our parents to open up their hearts and say, look, I have given birth to somebody that is different, and I am going to embrace that diversity, because at the end of the day, my child is human before their sexuality. So we are now trying to affirm parents to say, let's create this queer mom safe space where you are able to speak your truth without any judgment, where you are able to let us know of the challenges that you face in society, because we do not believe that you can give birth to a person and hate them solely on the basis of their sexual orientation or their gender identity is different. It's a fear of my child is going to be killed. My house is going to be burned down, because in the villages that we walk in, Yolan, there are other villages that don't even appear on the Google Maps. There's a village that we went to go do a dialogue with in the Greater Town municipality. The name of the village is Tor, and it doesn't appear anywhere. It's a very small village, and violence there, it at its ripe. Hate against LGBTIQ plus people. You can literally feel it in the energy when you enter that village, that something is completely off. But through that dialogue, we're able to meet with the chief of that village, and they were able to reflect on their community and say, this difference in sexual orientations or gender identity, it is not something that is modern. Because remember now, as a community, we are fighting the notion that being queer is an African. So now we go around schools, high schools, with parents trying to affirm them that your queerness is African. There's nobody that can separate your Africanism from your queerness, because of that is your identity. And we have to trace back in history to look at the Malubedu tribe that was here before even apartheid started, that identified as gender diverse. So now we are trying to strengthen support in communities, because we've realized that fear is one of the biggest barriers in terms of just accepting community members and their differences.
So, Faith, I mean, honestly, perfection in what you said, absolute perfection. We saw a hand quickly from Suki, so I think it was Sukiswa. Sukiswa, would you like to come back and ask your question? I think we have time for one question.
Um, Thank you, Yolandi. I want to say thank you, Faith, for a beautiful presentation. I would like to applaud you and your organization for what you are doing for young people. And what is more impressive about what you are doing is your work with the community systems, because mostly we work with structures at a high level with policies, of which South Africa has productive policies. And when you go to the communities, that's where the danger is. That's where our young people get killed. That's where discrimination is. And how you are approaching your work with these young people, I'm really impressed with how you're doing it. That's all I can say.
So thank you so much, Sukiswa. So basically, she's just giving you props, Faith. She's just giving you and your
Thank you so much,
organization
Vicky.
props. And I'm not going to mention that I was stalking Faith and her organization for many months before I approached them. There's like a very critical point from Jamison before we say goodbye to you. Jamison says, human rights activists, we need to advocate for policy changes to make it mandatory for parents and educators to report cases and incidences of human rights violations, stigma, discrimination in the community, healthcare facilities, and schools. I couldn't agree with you more. There was also one last comment from another colleague who said that we know there's a funding crisis, but we can come together as stakeholders, as community leaders, and put our heads together to find ways and solutions where we can share resources to ensure that programming is not lost. So that was fantastic that I noticed from the chat. Thank you again so much, Faith. And we'll be sure to share your contact details for these stakeholders to reach out to you for further. So without further ado, colleagues, let us move on to, I believe, something that is not given enough attention. And you can even see that in a lot of the funding that is being provided. And this is particularly programs and services for young people with disabilities. Young people with disabilities are at increased risk of human rights violations, including discrimination, denial of reasonable accommodation, inaccessible environments, abuse, exploitation, and exclusion from education, healthcare, employment, and community life. Nakose is sharing with you a video that was done with Childline on young people, disability, and sexual reproductive health.
So you must face it whenever you are. I was at school, I was so dizzy, and then and that's why some of the things that we are facing living with disability is a lot. I couldn't write, I couldn't read, I couldn't know my name that time. Yeah, never invited so can worry here take maybe ban trainee loco high lady therapy ban trainer bang like di bugate tsa bana tse gore ke khone go la pila again hona le batho ba loreng ba khone support go phelong gore ke accept or okay I'm living with disability ke khone bona gore life e teng.
And thank you again for the partnership with Childline Gauteng in making that video. We now have another individual who is a strong community leader around people with disabilities, Brandon Mafati from the Disabled Children Action Group in the Northern Cape. Brandon is a prominent community leader and youth advocate based in Kimberley. Brandon, he's collaborated with Sonke Gender Justice to help young people, including those with disabilities, accessing valuable workplace skills development, internships, and bursaries. He's an active figure in local community upliftment and is often looked up to for guidance regarding government and civic programs for people with disabilities and particularly young people with disabilities. Brandon, you are more than welcome. I do note, Brandon, that you might have some problems with your camera activity. So please feel free to unmute yourself regarding your presentation. We're showing your presentation now.
Okay, thank you so much. Colleagues, my name is Brandon Mfati and I'm the Provincial Director here in the Northern Cape Disabled Children's Action Group here in Kimberley. Our organization primarily focuses on support for children with disability. For the longest time, DCAG has been focusing on advocacy and policy development, making sure that we have influence over how policies are developed over time to benefit people with disability and make sure that when those policies are developed, they are developed in consideration of what the disability community needs and what's the best support that we can provide for them as government, as civil society, and private sectors also. So my presentation will focus today primarily at youth at risk, youth with disability and different types of disabilities, as well as those that are exposed to health hazardous risks such as HIV, TB, and so forth. Thank you so much. Can we move on to the next slide, man? Colleagues, according to Census 2022, South Africa has about 3.3 million persons with disability. Right? And Northern Cape is accountable for 7.6% percent of disability prevalence, amongst the highest in the nation. But usually this is because of Northern Cape has a very weird relationship with states because it's a very vast province with a very small population. So because of that, most of the states tend to affect us negatively. If you look into the country that the province that consumes most alcohol, it's Northern Cape. Also becomes one of the top provinces. You look at provinces that has a high burden of HIV or TB. Northern Cape is also amongst those. But I think it's because of this statistic and geographical disproportion that we have in the Northern Cape. So disability at oftentimes we've discovered that especially when it's intersected with poverty, unemployment, and unequal access to services, which leads to something that we call is either double or triple discrimination. And we try to develop programs that doesn't address one problem, but also focus on all other programs that are affecting not just persons with disability, but everybody that is exposed or that is affected by disability in their community. And also looking at how young people with disability these days experience a compounded exclusion when it comes to services. Like we've seen with the national government policy of employment, 4% employment of persons with disability, that is now been increased to 7%, of which the 4% was never met to start off with, which also throws us, which leaves us questioning a lot of things about how serious is government in developing and supporting, in developing policies and supporting persons with disability. Next slide, please. So, colleagues, the people that happens to be mostly exposed to these kind of situations are your persons with your physical disability, right? Whether it's your cerebral palsy, albinism, and then those that have sensory and intellectual disability, such as your autism, autism, and about those that are epileptic also. So we have always tried to develop programs that doesn't just focus on one disability. Our organization has five different types of support groups that we do. We have support groups for parents, which is an overall support group program that we offer in the province for parents of persons with disability. We call it peer-to-peer support network, where we bring together parents of disabled young people to share information on how to best take care of their children, whether it's in a clinical or non-clinical a manner, but also to build a network where these parents don't feel excluded by the community or by the environment that they are in. Because in most cases, we are still struggling with stigma in the community. And now it's even worse. You find that a parent, in most cases, they are they feel left out, or they feel deserted by the community in terms of support. Number one, our kids, the parents are even afraid of taking their children to churches, taking them to schools, taking them to public spaces because of how people perceive disability, which shows us that there's still a long way to go in terms of sensitization and fighting stigma in the community. So um amongst this, you find that young women and young girls are also exposed to sexual exploitation, and also a very limited access to human rights services in our communities. Which is why over the years we've tried to develop an implementation plan that cuts across all genders, all ages, and everybody that has been affected by social ills, whether it's with clinical services, non-clinical services, such as your social psychological support. So, colleagues, with the support groups, we also have a support group for LGBTQI communities that we offer, because we've realized that focusing only on disability is a problem, because stigma is a huge aspect of the problem that we are facing. Not only people with disability are not only youth with disability are marginalized, but also the LGBTQI communities also find themselves in a position where they don't feel respected, they don't feel appreciated by the system, by the communities that they are a part of. So part of the support group is to also capacitate them and give them more knowledge on how to become self-advocates in their own rights, to teach them about issues that affects LGBTQIs, and how, as well as how they can influence policies over time when they are being developed, and also linking them to some of these influential figures in the community that forms part of this policy development committees. And apart from that, the biggest priority that you at DKEC pride ourselves with is economic development for these population that I just mentioned. So we've also over the years developed a relationship um, with social employment funds and the Department of Labor to help these young people access job opportunities. I can confidently say that for 2025 to 2026 alone, we were able to employ more than 500 young persons with disability in the province alone through the program of Auto Youth Engage program that was launched from Joburg, and then it moved to the Northern Cape. So through that alone, 500 young people with disability were enrolled in skills development programs, and they are still receiving their stipends till this day. They are working with steel work, they are doing boiler making, they are doing woodwork also, and they're also doing auto mechanism program, which sometimes is a challenge, colleagues, because you find that some disabilities are not, some disabilities are not, you cannot, it's difficult to employ a person with a certain disability, or let's say a person with a physical disability, or that has a mobility challenge, to work in a landscape environment, to do gardening and agriculture. So we always try in that regards to at least recruit the closest member of their families and give them employment. Whether it's the parent, whether it's the sibling, whether it's the aunt or the caretaker, who does to make sure that at the end of the day, the person gets direct benefit of the economic opportunities that we are providing to their families, or if not themselves. So the our experience also with the youth in rural environment is that there's little less information and knowledge around issues of disability and issues affecting the LGBTQI communities, and stigma is much more prevalent in those communities, because now that's where you find that people don't have much information about these things, and they are still deeply rooted in their traditional beliefs that there's no such thing as LGBTQI, that disability is a curse. So it's a challenge to also move into those communities and teach them um, and also make them realize the importance of them also being advocates for these members that are affected by this um, situations. So the misconception grows. It's been a huge challenge over time. I can even tell you that we even have we had situations where we even had to go to local clinics and local schools to educate teachers, to educate nurses about these services, about these populations, because you'd find that our beneficiaries are complaining that I'm being denied access to prep because I went to the clinic in my school uniform, or when I went to to the clinic to get prep, I was told, why am I sexually active if I'm blind? So all those kind of insensitization in those clinical spaces becomes a problem that also makes it difficult for people to access services. And colleagues, these are members of our community also, despite them having a professional capacity that they play in the health sector. They are members of our community, and they've also been like most of the communities, they're also being misconceptualized over the years about these issues. So to then have to teach them about these issues from scratch becomes a challenge, because now to run these workshops, to run these programs and all those things, it's a lot of planning, it's a lot of logistics and all those things that we've always tried to ensure that at the end of the day we reach the intended outcome, and we make sure that the message gets spread across. And we also monitor after doing these implementations, because I also play a oversight role in the civil society of Francisburg, currently serving as the district chairperson here of CSF, responsible for more than for 12 sectors now in Francisburg. So we also try to play an oversight role in making sure that these programs are then implemented after that. But problem I mean sorry the challenge becomes the inclusive education and limited employment opportunities in the Northern Cape. So which is why we've also tried by all means to somehow try to teach others to excel in the entrepreneurial landscape. Like this week we are having a workshop for the whole week that will be focusing on entrepreneurialism and financial advice. So we also try to recruit these young people with disability to get this information, and also support them in the process of registering their businesses, staying compliant, reporting. Others also have passion for registering NPOs. We've also been in that space where we assist them with the registration and coordinate programs with them. But I can most definitely say that with the previous CSF structure that we've been having in the Northern Cape, we've been compromised for almost 12 years previously. So the coordination is still weak for us. But I'm happy to say that recently, yesterday, we had a consultation to formalize the MOU with IHPS, that is responsible for TV programs. Even today, now we are having a program for Youth Day, the closing of Youth Month program, and we are here delivering these services to these young people in the comfort of their communities and their homes, making sure they are tested, making sure they are screened, and if they're not comfortable to take those services here and now, then we can make an arrangement to maybe later go to a different place, because sometimes also an issue of them going to their public healthcare facilities because of they're in their neighborhood, and then people that are also employed, they happen to be part of their community, and people talk, and then because of that it makes it difficult for them to go and request services, so they would rather sit at home and not do anything at all. But also the holistic poor coordination between us, CSF, health, and also the justice and social development. It's something that is also been setting us back for years. Yesterday we also had a march. Colleague, you'll forgive me. It's a lot of activities that we try to come up with to really address these issues, because what I'm realizing is that we don't have time. These are serious concerns. So yesterday we had a march because June is albinism month, so and mental health awareness month. So we had a march from the Kimberley Library to Kimberley High Court to hand over a memorandum to the magistrate there, to also try and rope the judiciary system to making sure that policies is not just on paper, that policies become a living document. The judiciary must also play a role in making sure that those that develop policies become responsible for implementing them. Like I did mention earlier, that we were told about the 7%, the 4% employment rate of disability in departments, which was moved to 7%, and not even 3.2% was reached at that time. And I understand and I appreciate the urge of the necessity of the government seeing the government seeing the necessity to increase this, but what is currently being done in making sure that this is implemented is a challenge. So we are hoping that our judiciary system can also try and focus on those kind of advocacies to support the disabled people and the other marginalized group. So our response in providing programs, like I did say mention earlier, we do support groups. Apart from that, we do door to doors, and we try and identify and register children with disabilities on our database, and also youth with disability, to make sure that we provide services that are necessary to them. In most cases, you'd find that sometimes it's also like your disability grant. A person is not getting a disability grant, but they have a physical disability that you can see. Sometimes it's an intellectual disability, and then they cannot get any sort of employment opportunity, or it's not easy for them to be employed. So my secretary works in social development in SASA. So we try by all means to fast track these applications, to assist them with documents, compliant documents, and making sure that they we deliver, we end up making sure that they get those services, whether it's your social grant, whether it's your disability grant, whether it's your foster grant, or whether it's your care dependency grant. So apart from that, we also try to provide CP wheelchairs. We are struggling a lot with buggies, colleagues, because buggies are very much expensive. They range from about 14,000 per buggy, and for the buggy to be procured, um it's a process. It's a very long process of measurements, and all those things to make sure that when the bug is being designed by Shona Equipment, it literally fits the child. So I would, over the years, I mean, for the next coming years, I would like to see my organization providing more support, and giving more equipments, disability equipments to the community, because it's a very, very vital thing. Our department has admitted that for the past 10 years, they've never seen any, they've never had any donations of CP buggies. And most of the parents that we have been having these buggies since 2001. And you can imagine, since 2001 and until today, the child has grown. The buggy doesn't fit the child anymore, which is also one of the challenges right now. Those children cannot be taken to churches, to parties, to public spaces, because they just don't have, it's just not convenient for the parents to do so. And also trying to focus on the implementation of the white paper rights. We've also partnered with the Department of, sorry, with the Office of the Premier, the Office of Status of Persons with Disability. And last year we had the Disability Rights Awareness Month. And part of the main thing that the disability community was concerned about was economic opportunity, which is where the Premier of the Northern Cape decided to invest in the Social Employment Fund activity that is now responsible for employing young persons with disabilities to work in a factory that produces furnitures for departments and schools. They also produce garments and linen for hospitals and so forth. And they also do uniforms for nurses, for doctors also, and also for patients in linen also in these facilities. So the problem is also the politics, right? Because for the longest time, the companies, the procurement was done outside of the province by our government when they need furnitures for schools and all those things. So we had to bring the attention of the premier to say we do have a factory, a well-furnished factory that can produce these things. But every time when they get procurement, it's always outside of the province. So how about the Northern Cape government invest in this company, because it supports young persons with disability? So we've managed to overcome that, and we're just waiting, because now remember we are heading towards elections. So after the elections, those that are vacating office, the new ones are coming in, and the ones that are coming in, they also need to make procurements for their own office equipment and all those things. So I believe at that time it will be much more busy, because so far out of the 50 CVs that we've submitted, it's only 14 that have been employed in that factory. But it's only because there's no much work to do at this point. But as soon as the premier rolls out the funds for the next tranche, and then the implementation will grow, then we can have more people to join in, up to people to be employed under this program. So that's what we do. And more than anything, we would like to see our organization expanding beyond just Francis Bart or Pixley, but to have a holistic service delivery program in supporting disability and marginalized groups across the Northern Cape province. And challenge is that Northern Cape is broad, but we believe that with commitment and with the willingness to learn, participate, and grow as much as possible, we will be able to one day overcome this burden and have a community that is inclusive, that respects, that upholds the right of everybody despite of their differences. That will be all from my side, colleagues. Thank you so much. Thank you very much, colleagues.
Thank you so much, Brandon. Nothing about us without us, I think, is your key message. Brandon, I'm asking colleagues to please put their hands up for questions. There's some great comments in the chat that I'm happy to share, but please feel free to raise your hand. Brandon, just from what I've heard, some key points that I could summarize is the lack of inclusion of people with disabilities in employment sectors with employment opportunities. And it appears that a lot of that is because of the lack of assistive devices, within these workplaces or within these communities, but also a lack of understanding about the different types of disabilities and how one supports those different types of disabilities. I think you've said it beautifully when you said, take the services to the people, because people with disabilities, especially young people with disabilities, cannot access the services. Poverty, the infrastructure barriers in terms of the way our roads look, in terms of whether we have, areas where people can go up lifts or up ramps. So, public transport availability for people with disabilities, including people with, what one would term as not visible disabilities. So I think you raised some really critical points. But I noticed some comments in the chat, but let me first look to see if there's any hands that have been raised. Please feel free to raise your hand. I see no hands, but people are welcome to come in. I think that the one point that I saw in the chat, Brandon, that I want to just check in with you on is we sometimes forget about intersectionality amongst our groupings. For instance, there was a comment made by Rachel. Are there organizations doing any work with young people who identify as queer, LGBTQIA plus, and have disabilities? So, Brandon, as far as you're aware of, are we missing something here in terms of supporting people with disabilities that identify as people who use drugs, that identify as LGBTQI? What are we missing in terms of people with disabilities? Where are the gaps in terms of programming? Brandon, over to you.
Thank you so much, Yolan. I think the fundament starts with acknowledging and respecting that these are also human, right? Because in most cases, you'd find that the challenge is that, like I said earlier on, apart from our people not being capacitated, you find that the challenge is that a person with disability alone is disregarded, right? And then now you find out they're having now this other challenges. They are on drugs, and sometimes they are on drugs because of they want to belong, right? They want to be a part of a community, and peer pressure. They get easily influenced or enticed by their peers, and how we as society develop our interventions, right? We go, I remember we also had programs with churches, with faith-based organizations, right, where we thought it was going to be easy because these are people that understands, that are sympathetic. But it was also a challenge to realize that even within the faith-based organizations, there is still this kind of discrimination that they have towards a person with disability and the LGBTQI. And then you find out now the person has both. The person is an LGBTQI member with disability. So over the years, we've tried to have a support group. I remember the first support group that Nakosa introduced us to in 2024. 2024 in April, the first support group that we had of the LGBTQI community. And because we work with disability, it was only then we got to find out that we have young people with disability that also part of the LGBTQI community. It was hard. It was one of the most, I would say, in my years working in disability, it was one of the most impactful, touching, and the most painful 3 months of my life that we had to endure every day to have the support groups with this young people raising their frustrations, raising their how they are being violated and all those things, because you find that sometimes what makes it worse is that when the community does not support, it makes it difficult for the parents to also do so, because remember, these are also the parents are also the members of the community. So the stigma of what people are going to say also is something that rubs off to them, and it automatically affects the development of the well-being of the child over time. So it was from the 15 young people that we had in our support group that time, we had to refer 8 of them for socio-psychological support programs because of how intense it was, and it was something that was beyond our so it's not something that we were able to provide assistance to. So we tried by all means to refer them to clinical professionals that counseled them. But now it's a problem because you get counseled and then you're coming back to the very same community. So I think what we need to do is um, upscale or escalate the amount of intervention or the level of intervention that we do when it comes to community. Let's not just focus on those that are affected, but let's focus on the ones that live with them at the end of the day, to ensure that everybody understands the uniqueness of everybody, and then everybody accepts everybody for who they are, and then it's easy for people to excel. It's easy for people to function in the community, because these are the most creative people that have been around. The LGBTQI community are very creative. Even now today, the event that we are having today, Kamveli Performing Arts, it's also an organization that is ran by LGBTQI communities. They sing very nice. They are very committed to their work. They are always doing community work, advocating for themselves. And I think as a community, we need to look into the good that these people are bringing to their community and start supporting them instead of casting stones on them, because of we are the problem. They are not the problem. The lack of sensitization, the lack of information, the misinformation is the reason why these people are carrying this burden that they are carrying in the community.
No truer words were said, Brandon. Thank you so much. And Brandon, I'm just gonna close off now with Virginia's comment, and which I think is so critical. Virginia said, policy is being implemented, or there are policies. We're waiting to see the change. And now hearing what you say, Brandon, is that the change must come soon because people are being left behind, and especially young people with disabilities that intersect across all other groupings. So thank you so much, Brandon, for your we are now looking at our last section around young people at risk, and this is specifically focusing on young people who use drugs and engage in sex work. Young people who use drugs and engage in sex work are at heightened risk of human rights violations, including gender-based violence, police harassment, exploitation, denial of health services, and violation of their dignity, privacy, and equality. A video that was done with our GC6P with people who use drugs implementers last year showcases a video around young women who use drugs and the human rights violations, the horrendous ones that they experience.
I was a drug addict starting from 2012 until this year, 2024. I was injecting myself, I was using heroin. I didn't even have hope anymore in my life.
You know when you feel like you're not a human being, and you're treated like you're not a person or statistic?
Remember that women who use drugs are really discriminated against, and they go through so much trauma. You're seen as you're a mother, and everyone is expecting mothers to be perfect.
The life we live here on the streets, we get raped like by people we know.
So communities need to support them, communities need to understand their journey, communities need to understand their choices, and communities need to understand that they are not different from an ordinary person who doesn't use drugs, so that you can hear the story behind, because we all have stories to share.
Thank you so much, Tanswala, for your support in that video. And we all have stories to share, and we all should have an opportunity to be heard. So one of the best people I know, advocate of note in this country, is Charity Monitoring from Students with Sensible Drug Policy International. Charity is the Executive Director of Students for Sensible Drug Policy International, focusing on empowering youth to advocate for drug policy reform through grassroots organizing and civic engagements. Uh, Her work prioritizes justice, compassion, and the reduction of harm caused by ineffective policies while fostering young leaders in the global policy reform movement. Her expertise lies in public law and criminology, informs a mission-driven approach to advocating for equitable and impactful policy changes on local, national, and global levels. Charity, if I may be so bold to congratulate her, has been newly elected as the chair of the New York NGO Committee on Drugs. It is a global civic society platform that engages with the United Nations on all matters linked to drug policy. So once again, Charity, welcome and congratulations on your new appointment.
Thank you so much, Yolan. And thank you for this opportunity. I think this has been a work in progress. And really congratulations as well to Nakosa for publishing this policy brief that I'm about to present on. And from the speakers that have spoken before me, I think they've already shifted the conversation from what's wrong with young people to what is actually happening to young people and how our policies need to be responding. So too often we discuss youth and drugs. The conversation begins and ends with criminalization and abstinence. And the reality is, of course, more complex than that. So many young people who use drugs are also navigating poverty, violence, homelessness, family instability, mental health challenges, and exclusions from services, as we've heard from the previous speakers. And if we genuinely want healthier communities, we need policies that respond to these realities rather than punishing them. Next slide. So when we speak about youth at risk, we need to recognize that the risks really exist in isolation. So many young people we work with and many of your organizations as well experience several risks simultaneously. So for example, a young person who uses drugs may also be experiencing violence at home. They may be homeless or living in unstable housing. They may already have dropped out of school and also may avoid accessing healthcare because of the fear of being arrested or facing judgment. So in the policy brief that I wrote, it basically highlights that young people who inject face particularly high risks of HIV, hepatitis, and overdose, and yet remain among the least likely to access harm reduction services because these services largely are designed for adults. And I think one of the comments earlier is that a lot of the services are not youth friendly. And so if something is not attractive to young people, they're are unlikely to access any of these services. So I think the important point is that drug use is often one symptom of broader social vulnerability, and it's not necessarily its cause. And unless we start addressing those structural vulnerabilities, we will continue treating symptoms rather than solving the actual problems. Next slide. So why do these risks actually exist? So the risks are not inevitable. They are produced by the environments that young people grow up in, the country that we live in, and of course, the work that we all do identify several interconnected drivers. So youth unemployment and poverty, of course, reduces opportunities. Communities with high levels of inequality often experience greater exposure to drugs, gangs, and violence. And because gangs particularly fulfill a role that government necessarily doesn't, young people are more attracted. And that's what makes gangs attractive, because they want to belong. Gangs, unfortunately, create this economy, even though it's illicit, but it creates an economy that government or the state is not providing. And so historically, inequality continues to shape where services exist and where they do not. Apartheid spatial planning ensured that services are are way out of reach for certain communities. And so if people are not able to access them, they will not be able to get those services. Criminalization also pushes young people away from healthcare instead of towards it. So because substance use and sex work are criminalized, people are less likely to access services because they know that if they're out there and people know that they use drugs, they will either be arrested or violated, as we've heard in the video previously shared. And of course, one of the biggest things is that stigma still remains one of the greatest barriers, not only by families, but also in healthcare services. And many young people tell service providers that they would rather avoid seeking help than risk being judged by healthcare workers, teachers, the police, or even their own families. And so the consequence is that young people who need support are most often the least likely to receive it. Next slide. So what support is actually needed? So if these challenges, so there are these challenges, and then how then do we need to respond? And so from research, and I think even the work that we all do, young people need integrated services. That means ensuring that harm reduction, mental health support, sexual reproductive health care, safe housing, legal support, peer support, and youth-friendly clinics all exist in one space. And so rather than sending young people from service to service, we need to build systems where multiple forms of support are available in this one-stop shop. Because young people don't experience their problems separately, and so our services need to also be together and not be separated. Next slide. So some of the gaps that exist, as we all know, South Africa has beautiful policies. Unfortunately, they're not adequately implemented, and our laws also prevent or cause most harm, actually. So this is where policy becomes incredibly important. And the problem is that they often contradict one another. So, for example, the Children's Act recognizes that children aged 12 and older may consent independently to access medical treatment if they demonstrate sufficient maturity. However, when it comes to harm reduction, which is a medical service, service providers have frequently remained uncertain whether they can legally assist young people or not. Many organizations, as I was writing the policy brief, mentioned that they've been discouraged from providing sterile injecting equipment or other harm reduction services to minors, despite evidence that these services actually save lives. And so some of the recommendations that have come out is that we need to ensure that policies or legislation is reformed that intentionally unblocks access to care, which means decriminalizing personal use and possession for personal purposes, full decriminalization of consensual sex work. And I mean, the sex work movement has been exemplary in showing us the efforts that go into ensuring that that sex work is recognized as work. And so we're also embarking on a journey now on the decriminalization of personal drug use and possession. We also need to start developing youth-specific harm reduction programs, but any other programs that are youth-centric and that are youth-specific, because a lot of the services that are there, particularly the ones that address substance use, are not youth-friendly, and so young people are not accessing them. And I think one of the areas that we tend to forget is also the people that provide services to young people. So you have people that will want to provide services, however, they're not protected as healthcare workers as well for providing services that may deemed illegal. And so we need to ensure that healthcare workers and community care workers are also protected. We need to also integrate harm reduction into existing adolescent health programs, but also involving young people themselves in designing these services. And I think this has been a theme throughout the presentations as well, that young people need to be at the center of the development, the implementation, and the monitoring of services about them. And also, most importantly, it's not about encouraging drug use. So harm reduction is not about encouraging drug use. It's mostly about preventing HIV, preventing hepatitis, preventing overdose, and essentially just preventing harms related to substance use and protecting young people's right to health. Next slide. And so this slide is just an infographic from the policy brief. So the recommendations, rather, the first recommendation is recognizing that young people who use drugs are first and foremost children with rights. Our Constitution, of course, recognizes the best interests of the child as paramount. The UN Convention on the Rights of the Child reaches the same conclusion. That means health services should be available when they are needed, not only when a young person reaches adulthood. Second recommendation, we recommend establishing clear legal protections that allow evidence-based harm reduction services for minors from age 12, where they demonstrate sufficient maturity consistent with the Children's Act. Third, young people must help design these services. Nothing about young people should be decided without young people's participation. And of course, finally, we need better data. When doing this policy brief, and I think in a lot of our work, particularly around young people or minors who use drugs, the absence of national data should not be interpreted as evidence that the problem does not exist. And so instead, it tells us that we need to do better research and better monitoring systems. Next slide. And I think my last slide, and one of the most exciting things. So alongside policy reform, we also need innovation. So young people are on digital platforms. And so one of the things that we have done as SSDP is to develop an app. It hasn't been launched yet. It's still a work in progress, but it's basically an app that sets out different scenarios for young people. I think if I have a few minutes, Yolan, I'll be guided by you to just demonstrate the app. So it's an app that has sets out different scenarios for young people. They're able to select a respective scenario, go through a few questions, answer the questions on what they would do in a specific situation, and then they get given a quiz as well, just to test their knowledge. The app also has a platform for resources, a community forum where they can share their stories anonymously. And so thank you, Yolan. So I'm just going to demonstrate the app. It's called Next Move. Still a work in progress, but something that I think we're proud of and really excited and looking forward to launching sometime. Okay, I'm not sure if everyone can see my screen. Okay, I think everyone can. All right, so this is the app. It's called Next Move. So just an example, for example, we cover different aspects. So safe nightlife, and we try to pick out nights that or scenarios that are very familiar. So for example, long street after dark, something about communication or finding your voice, overdose prevention, safe nights in Jersey, Ekasi after dark, information about vapes and smoking, substance use education all together. And so if I can just demonstrate, for example, so how it works, you basically start in a question or a scenario. It asks you a question, you're feeling overwhelmed by school, family expectations, and social pressures. Everything feels heavy. A close friend notices you seem different. And so you go ahead and you pick the correct answer, whether you say you're fine and change the subject, brush it off, or open up about how you're feeling. So it takes you to the next question. Your friend listens without judgment and suggests talking to a counselor. What do you do? Then you accept the correct one. And then you receive a badge for every scenario that you complete. And then it also allows you to take a quiz. And there you go, you get different questions, 4 questions. Once you're done with the quiz, it then gives you a badge and you progress throughout the app. So this is the app, that's the scenarios. You're then also able to go into resource support. So here, different platforms where young people can access services. So we made it global, but also local. So you have your SANCA, Department of Social Development, and other areas. You're also able to access different resources. You're able to also ask questions on the community forum and get a response, but also sharing stories about how you experience, and someone can respond with either words of comfort or guiding you to the specific services that you need. So this is the app I just wanted to share. Thank you all so much.
Charity, how soon are we going to be able to access that app?
This is the question I've been getting. But I mean, if there's interest, then for sure we'll be able to access it. It is web-based, so people don't have to download it. We were mindful of people not having like smartphones, so you're able to access it on a web page. So you just get the link, you go on the app, and young people are able to play around with it. So based on feedback, we can add more scenarios, we can make the scenarios longer. But yeah, if there's interest, we're happy to launch I guess in a few months or a couple
So,
of
so
days.
Nakasa was quite fortunate to be able to test out this app. So I'm very keen, very keen. So let's be in contact, and then also to reach out, because I think we have such a wide variety of people that has attended this webinar that would be providing valuable input to that app. So please, Charity, please reach out, and we can see how we can access other platforms. There's regional representatives here as well as national representatives. So I'm looking forward to seeing that app go live. Thank you so much, Charity. Charity, we'll go quickly and see some things, but I just want to make a note that from Nakosa's side, we are seeing some positive movements, in terms of recognizing harm reduction. Always a tricky one when it comes to minors, right? Always a tricky one when it comes to young people, parents and religious leaders and everybody, aunties and uncles, very hesitant to talk about young people. So I'm so proud of the policy brief that was, worked on with you. But we are seeing positive movements. I mean, Nakosa last year was able to support with the National South African Police Services, where they posted and put forward a national directive to all their police stations that the police officers are to cease any confiscation of sterile needles and syringes, because they recognized harm reduction. They recognized, the need to see this as a health commodity. So some great movements happening in our country, but perhaps not fast enough. Not fast enough. So I don't see any hands, Charity, but maybe I'm going to put you in a dark space right now and say, you spoke about intersectionality, you spoke about integrated services. How, with this funding situation, with what's going on right now, with exiting with out of the country, valuable harm reduction services for sex workers, LGBTQI, people who use drugs. Yeah, it's looking dark, or maybe it's not that dark. What do you think?
So I'm a firm believer that our country has money. And we're just not directing those resources where we need to. Substance use, because we don't have the statistics. I know governments have this denialism that if we don't have the numbers, then it doesn't exist. We don't have the statistics on the extent of substance use in our country. But I mean, from all organizations, it's a huge problem. I think it's become really bad, and I think from some of the statistics from organizations like Nakosa, from organizations like Sanka, where they're starting to see younger people going into rehab or treating younger people with rehab, then we have a very big problem. But I think because our response has been, our law says substance use is a crime, and I think the fact that we see use and possession as a crime, people are not going to come out of I don't want to say the woodworks, but people are not going to be able to openly say that I'm a person who uses drugs, because it's considered a crime. And so I think we need to start shifting our response to addressing substance use as a social issue, but also a public health issue. Because now, because it's a crime, police officers are automatically the ones called to address the issue. It's not social workers, it's not the different departments that are called to address the issue. And so I think we've gotten to a point as a country where we are realizing that what we are doing has failed. We just need the political and willpower to actually have this shift. on how we can properly address this issue. And for young people, like you say, it's very tricky because there's also a denialism that young people are not using drugs. These things are taboo. But we're doing such a disservice because a lot of our focus has been on abstinence and prevention. And that's all we look at because, yes, a majority of our young people are not using drugs, but the portion that we have, we creating our own problem, an even bigger problem. And we live in a country that is very reactive. So until it becomes a massive problem, that's when we're going to act. But I think yeah, like I say, I'm a firm believer that our country has money. The resources just have to be shifted to priorities, and not always focusing on security. Yeah.
So domestic resourcing is critical, and we need to stop relying externally because we need to look at sustainability in short. Falapi, I hope I'm pronouncing your name correctly. Falapi has made some really good questions and points in the chat around minors, securing minors' rights, but also looking at intersectionality. A Charity, but I don't think it's a question just for Charity. I think the question is for Brandon. I think the question is for Faith, is when we talk integrated, are we really integrating services? Are we really making sure that our policies speak to each other? And so I think that this is actually something that we must maybe take out, Charity, and reflect with Faith and Brandon and other stakeholders and provide a more comprehensive support and maybe a call for action. Thanking you so much. I'm going to take note of those particular questions, and maybe we can provide some type of response when we send the presentations and the recordings of this webinar. And Nate, thank you so much. I see that you've also asked a particular question in the chat around people are considered high risk if they have non-regular or multiple sexual partners engaging in sex work. Uses drugs, are teenage pregnant parents, but these are difficult questions to ask and answer, but they're usually used as part of a risk screening tool and are often the first and only touch point that young people have with programs. Nate is concerned that the pressure of this being risk assessments being the first encounter it's a risk to determine eligibility, creating data, predicting the risk, building trust, as well as it's too much to expect from a questionnaire, especially from people who are expected to engage with it. So I think we don't have time to necessarily explore this, but I think again, Charity, when we are program designing and looking at reach and having risk assessments like this, are we doing justice to the program by marginalizing it to a risk assessment? So I think this is a really good point, Nate, and thank you so much for that. Charity, always a pleasure, and please feel free to reach out with your app so that we can share for people to engage with it and provide any particular feedback. So, and once again, colleagues, just to note, the policy brief that Charity referred to, as commissioned by NACOSA with the funding from the Global Fund and developed by the Students for Sensible Drug Policy International, is available on the NACOSA website, and that link was provided in the chat. So as we have gone over time, may I just once again send a heartfelt appreciation for my speakers, Faith Edmonds from the Color Me Foundation, Brandon Mafati as the Provincial Director of the Disabled Children's Action Group Northern Cape, and also to Charity Monoreng as the Executive Director of Students for Sensible Drug Policy International. I saw the engagements in the chat. People want to hear more about this. People want to explore more. People want to come together and put their heads together to look at how do we do sustainable, integrated programming that addresses policy gaps or supports the implementation of the number of policies that we have that are not doing justice on the ground. So thank you again to my speakers for being part of this webinar, Youth at Risk. Now, the recordings and presentations will be emailed to all attendees shortly. And once again, can we just say thank you to our translators from Happy Clouds? I think, accessibility is crucial through the sign language interpretation. And then also our technical team from Strativate, who has been with us in terms of the planning of this webinar and the coordination and recording of the webinar. Thank you so much to the technical team. And once again, thank you to the Global Fund for providing this opportunity to raise these critical issues around the risk experienced by youth at risk, but also the human rights violations that continue to provide challenges. Thank you so much, everybody. Keep well.